So, hi, Liz from Stautzenberger College Practical Nursing Program. Today I'm going to demo oral medication checkoff. So you're going to start your pharmacy checkoffs with your 6 rights. So right patient, right drug, right dose, right route, right time, documentation at the end. You're also going to give 4 considerations. So my considerations are going to be check patient allergy, check complete drug history, check expiration date, and educate the patient. Then you're going to go into your CG wipes. So I checked my policy and procedure, I gathered my supplies, I'm going to go into the room and identify the patient and myself. So I'll wash my hands as I go into the patient room. Hi, Mr. Walker, my name's Liz, I'm going to be your nurse today. Do I have permission to touch you? Okay. I'm going to check your name and date of birth on the bracelet. He's going to verify it for me. I'm also going to check for allergies on the bracelet. Okay. So I'm going to provide safety. My railings are up. I would put the other railing up, and privacy by pulling the curtain. I'm going to explain to Mr. Walker that I have some medications for him this morning. One is for his blood pressure. It's a pill he's going to swallow. His blood pressure was elevated, and so was his pulse. Ask him if he's had it before. Does he have any questions? Nope, he's good. He's got his call light. He's safe. I'm going to wash my hands and go prepare the medications. So back at my cart, I have my physician's order as well as the MAR. First step is verifying the MAR. You do that by checking against the physician's order. So Terrence Walker, patient number 15461, metapropyl, right drug, dose is 100 milligrams, right route is by mouth twice a day. And then I have pulled if blood pressure is below 100 and or pulse below 60. He did not meet this criteria. So time is now, I will document at the end. I'm done with my physician's order. I'm only going to be working off the MAR. So I'm going to make a little more room. I'm going to find Mr. Walker's drawer, and I'm going to pull out the medication, do my first check. So my first check is right patient, Terrence Walker, patient number 15461, right drug, metapropyl, dose, 100 milligrams. Now this is 50 milligrams per tablet. So you'll have to do your math. Your desired over half. So I'm going to end up giving 2 tabs for the 100 milligrams. Okay, so I know I have the right dose, right route is by mouth, time is now, and I'll document at the end. I have my cup. I know I need 2 tabs. And then I'm going to get my patient label. As I do my second check, I'm going to write my label. So I have the right patient, Terrence Walker. I have the right patient number, 15461. Right drug, metapropyl. I have 100 milligrams or 2 50 milligram tablets. It's by mouth. Time is now, and I will document at the end. So there's my second check. I'm going to label my cup, and I'm going to put my medication away. You never want to leave medication out on the cart. So I have my cup of water, I have my medicine, and I'm going to take my MAR into the patient's room. Okay? So let's go to the patient's room. Hi, Mr. Walker. It's Liz again. I'm going to wash my hands when I come in. All right, can I have your name and date of birth again? Verify your wristband. Thank you. Any problems swallowing pills? He said no. Now, before you can give your medication, you have to do your 3rd check on the bedside. So, I got my cup and my MAR. I'm going to say right patient, Terrence Walker, 15461. Right drug, metapropyl, 100 milligrams. I have 2 50 milligram tablets. It's by mouth, twice a day. Time is now. I will document at the end. So, okay, I'm going to give you your pills. I'm going to have you swallow it, and then I'm going to make sure you swallowed it. So go ahead and get some pills. Here's a drink of water. Okay, now can I make sure they swallowed it? He swallowed it, so I verified he took the medication. Okay? Do you need anything else right now, Mr. Walker? No? He's safe. He's got his call light, bed rails up. I'll be back to check on you in a little bit. Okay? I'm going to wash my hands as I leave the room. Now back at my cart, I'm going to document. So I write my name at the bottom with my initials. I cross off the medication I gave and initial that. So it is filled out. And then you're going to make sure you evaluate your patient. I'm going to go back in 15 minutes. Did his blood pressure come down? Did his pulse come down? Is he having any signs and symptoms, any adverse effect? If no, we're good to go. This concludes the oral demonstration.